provided since then. Mr. Mazzoni, your agency, the Army Audit Agency, issued a report about KBR's charges under the LOGCAP contract for DBA insurance. And the committee obtained a copy of the report, and we're making it public today. I thought your findings were pretty astounding. KBR hired AIG as its insurance company. Your report, page 5, says that AIG charged KBR about $284 million for DBA insurance from 2003 through 2005. Is that right?
That is correct. One clarification, sir. My understanding is that KBR actually did not buy the insurance. I'm not an insurance expert, but I understand that KBR actually had to use an insurance broker in the state of Texas, and that insurance broker then bought the insurance for KBR.
And did the insurance broker get a fee for doing that, the purchase?
I honestly don't know.
The total cost of providing this insurance is actually higher than the $284 million. KBR has a cost-plus contract, so it can add up a markup up to $8 million on top of the $284 million premium to AIG. This makes the total cost to the taxpayers as much as $292 million, all of which I mentioned in my opening statement. Your report, page 8, also says that of that $292 million, AIG will pay out about $73 million in claims after all adjustments and reimbursements. Is that right, $73 million?
That's what we found, yes.
So, looking at it from the taxpayer's perspective, the purpose of this insurance is to provide injured workers with benefits. Yet under this contract, the taxpayer is paying nearly $300 million, and the injured workers are getting less than $75 million. I'm trying to figure out if this makes any sense. Mr. Needham, you represent GAO. Do you think the taxpayers are getting a good return on their investment?
Based on the data that's been presented today, Mr. Chairman, it's not apparent that they are. And one of the concerns that we've had is that DOD needs to be more on top of this in terms of what it is that we're spending. DOD took on a practice of doing spend analysis several years ago after we had issued reports on best practices. They've done this for other areas. Clerical services, they do it for software, wireless services. This represents an opportunity for DOD to get on top of that so they could get a better return. And what we're doing...
Well, that's certainly one of the purposes of the hearing. But we're trying to see where we are before we get them pushing even harder to get where we should be. KBR and AIG set the price of the insurance. Neither of them pays the bills. The taxpayer does. That means they have no incentive to keep costs low. Because KBR is operating under a cost-plus contract, the higher the premium it pays AIG, the more money it makes. Now, Mr. Mazzoni, do you think it makes sense to rely on a contractor like KBR, which has a cost-plus contract to negotiate its own insurance?
Again, sir, the way I understand it, they did not negotiate it. It was the insurance broker in Texas. We do know that...
They relied on their broker, but none of them paid them.
None of them paid, correct.
And they had no reason to hold on to the
contract. We do pay the cost. One or two things I would like to mention is that the KBR safety record is actually very good. And the safety record is used when negotiating award fees. During our audit, when we brought this to the attention of KBR, as far as the rate increases in FY03 to FY04, they did question their broker.
Well, the concerns about this problem are not new. Since 2005, auditors and experts have been warning that taxpayers are being overcharged. It's been hard to get a definitive picture of what's really going on with this program because the administration has not wanted to compile the data. So that's what we tried to do. We asked the top 4 insurance companies that account for more than 99% of the DBA market to provide the committee with profit and payout data. And we're now able to see some concrete trends. What the data shows is that from 2002 to 2007, these 4 insurance companies received $1.5 billion in premiums under contracts negotiate with private contractors in Iraq and Afghanistan. These companies will pay out $928 million in claims and expenses, and they will retain net underwriting gains of $585 million. In other words, these four insurance companies have retained as profit 39% of the premiums they received. Now, my time has expired, but I certainly wanted to pursue this with Vindman and others because it seems to me it's quite excessive. But other members may want to question on this point, and I think it's well worth it. Well, I have one or two questions to wait. Thank you very much. If not, the other members on the second.
All right, Mr. Mosher, let me start with you. You know that in your testimony there were 4 offerers during the state's most recent DBA competition, is that correct?
Yes, that's correct.
When was that contract awarded?
In 2001.
Can you speculate for us why state gets more offers than on the court?
Well, it's very difficult for me to make the comments about any other agency's contracting activity. I will say for our contracting activity, we very much want to promote as much competition as we can get. So I'll turn that over to Mr. Dalton for comments about the Army.
I think maybe one of the reasons why we get fewer offers in the State Department is because we concentrate heavily in more hostile areas than perhaps the State Department. A large part of our work is in Iraq, is in Afghanistan, and some over in the Balkans. And so when we get our prices and contractors take a look at where we're working, there's a higher risk associated with bidding on Corps of Engineer contracts and perhaps State Department more spread out across the world.
Last year, the CBO estimated that creating a single DBA insurance pool for the entire DoD would save the government millions of dollars. But the CBA also warned that due to the increased government administrative costs and the uncertainty over whether insurance providers would be willing to underwrite such a massive policy, the creation of such a pool would not necessarily result in savings for the Department of Defense. Creating a pool would also effectively subsidize contractors in more dangerous areas by charging inflated rates to those in the safer areas and subsidize contractors who you understand what I'm saying. Would the creation of this type of department-wide insurance pool result in savings to government? We just asked to start with the GAO. What effect would it have on contractor safety systems? Would this type of arrangement result in more contractors moving to self-insurance models? What's your thought on that?
Mr. Davis, in terms of looking at options, one of the things we recommended back 3 years ago was that DoD begin to assess the various options. What they actually did was adopt the Army Corps' single insurer program for the Corps. What we'd like to see them do is to look at possibly the government as a self-insurer. That's one option, but you can create multiple pools. There are trade-offs, and according to Admiral Vindman, they're going to be looking at these possible business case on this and what they can do in terms of whether or not what the risks are with various job categories in various parts of the world. This is what we're looking for, that they make this kind of trade-off analysis. They haven't done this yet.
Let me ask you, could you, for example, do a single provider system for Iran and Iraq and other regions of the world, and you could do 4 single provider systems? How would that work? Seeing that it's so large and diverse.
Mr. I think as Mr. Newman said, there are a lot of options available to us. We frankly don't have the data today. We have committed that we will go collect the data. A single contractor for risk pool for Iraq and Afghanistan is certainly an option. The single contract concept that state and AID and Corps is an option.
Well, let me ask you this. Wouldn't a single contractor for Iraq, Afghanistan make more sense than one across all regions, given the different diversity and risks?
I think from a risk pool perspective, having a single contractor in Iraq and Afghanistan would make sense to me personally. But I'm doing that without the benefit of the business analysis to make that determination on.
How many insurers are there in Iraq and Afghanistan? Any idea?
Department of Labor has worked with the Joint Contracting Command in Iraq and Afghanistan. There are currently 3 that are being used. And the Department of Labor is working to add a 4th so that the contractors doing work, particularly the local contractors, have an option of 3 today, and hopefully they will have an option of 4 soon.
And what generally happens is the contractor hires the company, we just reimburse.
Absolutely. It's the contractor's responsibility to pick the trucks.
And they have to take it off the approved list.
Yes. It is approved by Department of Labor.
And, okay. Thank you, Mr. Davis. Mr. Cooper.